In rhinoplasty, we look at several key criteria to establish the cost of this particular operation. The first of these is the patient's examination findings, meaning the aesthetic changes to be made, how complex the required work is, and if it necessitates significant major alterations. For example, some patients only need a tip plasty, just a tip aesthetic procedure. The nose cost varies. For some patients, an aesthetic intervention involving the entire bone structure is necessary. In that case, the surgery's price will be different. The second key factor is whether the patient has a deviation, which means they have a functional issue concerning their ability to breathe properly. If the patient presents with a functional issue, the primary causes are typically an internal deviation in the bone or cartilage structure, the existence of a deviation or excessively large nasal turbinates. If there is an internal deviation or curvature problem, a septoplasty operation must be added to the rhinoplasty. If the turbinates are large, radiofrequency reduction is necessary. Naturally, these procedures performed will affect the cost of the surgery to some extent. Besides this, another criterion that will affect the surgery in rhinoplasty is the choice of hospital. Since I operate in 4 or 5 different hospitals and their classifications differ, there is a difference between hospitals concerning the final price and overall cost. Consequently, the surgery's scope, including the presence or absence of any deviation, the presence or absence of a breathing problem, and the choice of hospital will be the main criteria affecting the cost of rhinoplasty surgery. In any case, I would like to convey to you via screen and broadcast what I tell my patients during their examination. I have never been a person who is troubled by cost. Of course, I will try to help you, my patients, as much as I possibly can.